Welcome back to The Race here in Fort Lauderdale, Florida. This is a place that a lot of retirees come to spend their time in the sun. But it is a fact of life. As time goes on, inevitably health issues arise. How about these numbers? Recent studies saying that an average 65-year-old couple will spend anywhere between $250,000 to $500,000 on health care through the rest of their lives. Our Nicole Vowell bringing us to a local pharmacy that's serving seniors who spend a ton of money on prescription drugs every day.
It'll be just a minute, I'll get it for you.
Registered pharmacist Drew Miller has been listening to the same squeaky door since 1995.
We're thriving and doing well and working as hard as we can to take care of these people.
He sees the struggles his customers face daily trying to fill their prescriptions.
We try to work with them to find cheaper alternatives or different ways to get things paid for.
And most of those customers are around the same age as Wayne Johnson.
I probably spend $600 or so a month.
That's a lot of money.
It is, yes.
74-year-old Johnson pays a hefty price for necessary meds, is on a fixed income, receives retirement, Social Security, but when it comes to Medicare,
it doesn't pay for my prescriptions, so I have to buy additional insurance to take care of that, and I have to buy the Medigap insurance. So I'm spending probably $400 or $500 a month for insurance on top of the medications.
Seniors all across America are facing the same and have been for years.
No such thing as cheap medication.
No, there's not.
In 2015, the cost of common medications for older Americans jumped 15% and keeps climbing. The AARP reports 81% of seniors think drug costs are way too high and want politicians to do something.
The Congress that we have right now is a total waste of time and money.
Solutions for seniors, Johnson says, seem hopeless.
Sometimes I'll get a phone call from somebody that says, this month my heating bill was extra high. Can I delay my payment on for my medication?
Sad for people like Miller who see it firsthand.
How you doing today?
And although he tries to help the people in his own community,
all right, get some change,
by offering payment options and going above and beyond the call.
And we're on the phone a lot and making phone calls and faxing and emailing and all trying to get something that's the best possible outcome for the patient.
He says the real work has to come from Congress.
If the sides don't work together to make something happen, the mess isn't going to fix itself.
For The Race, I'm Nicole Vowell.
The president recently said that Medicare and Social Security are getting stronger under his administration. PolitiFact putting that statement to a truth test.
This particular comment came during a meeting with the leader of Kuwait. Here, check out what the president said.
We're saving Medicare. The Democrats want to destroy Medicare. You look at what they're doing, they're going to destroy Medicare. And we will save it. We will keep it going. We're making it stronger. We're making Social Security stronger.
So our partners at PolitiFact dug into that claim, and here's what they found. Funding for Medicare Part A, which is the one you automatically get if you qualify, comes from what's called the Hospital Insurance Trust Fund. Most of that money comes from payroll taxes. In last year's Medicare Trustees report, the fund was expected to run out of money in 2029. Well, now they're saying 2026, which is 3 years sooner. PolitiFact found that change is due to low wage growth and the Republican tax cuts. The same things are having a negative effect on the main trust fund that goes into Social Security. Last year, that fund was expected to run out in 2035, and this year it's 2034, so 1 year sooner for Social Security. The president said his administration is making both Medicare and Social Security stronger, but because the forecasts for both programs are worse today than a year ago, PolitiFact rates the president's statement as false. I'm Kumasi Aaron for The Race.
The countdown to November is on. The race continues from South Florida next.